Do you know how heat stroke feels like? Well, collapse during extreme heat, sometimes leading to delirium or coma. Someone with a mild form of heat stroke, known as heat prostration, will appear faint, have cold and clammy skin, and have a slight fever. If a person with heat stroke falls into a coma, becomes delirious, or has hot and dry skin, and a temperature of more than 103 degrees Fahrenheit, seek medical help immediately. Now there are 4 important questions that you need to ask your patient before making a diagnosis. Firstly, you need to ask the patient about headache, changes in thinking, loss of consciousness, nausea, vomiting, diarrhea, decreased urine output, sweating, cold skin, muscle cramps, and the bleeding. Secondly, you should know family history of your patient, such as alcoholism, heart disease, high blood pressure, and diabetes. You should ask your patient that how long he or she was in a hot environment, the temperature of the environment, temperature of your patient at the time of collapse, and what your patient was doing when he or she collapsed. Now, one more important question you need to ask is about his medication history. If your patient is taking any medications, such as alcohol, antihypertensive medication, diuretics, atropine medications, phenethazine, and the antipsychotics. Well, this is because this particular condition might be the result of adverse drug reaction to any of these drugs. Now that you're well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes temperature, breathing rate, blood pressure, pulse, thorough exam of your reflexes and movement, checking skin for sweating, color, and warmth. Now, what can cause heat stroke and what is typical for each cause? Well, there are 2 different causes of heat stroke that you should be clear about: the dehydration, inadequate sweating. I'll be explaining these terms in a while. Now, moving to first cause of heat stroke, if the patient shows symptoms like the dry mouth, producing little or no urine, sunken eyes, more common in people taking blood pressure medication or drinking alcohol, then this might give you an indication that patient has dehydration. Well, dehydration means not drinking enough water. But if your patient has typical symptoms like the lack of sweating when hot, more common in the elderly, diabetics, those with high cholesterol, people wearing too much clothing, or engaging in excessive exercise, or people taking anticholinergic medications such as Benadryl and Cogentin, or phenethazines such as the antipsychotic Haldol, it indicates patient has inadequate sweating. Inadequate sweating means an inability to cool down by sweating. Then, this might be an indication that patient has inadequate sweating. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. Stay tuned to sqadia.com for more precise and knowledge-stuffed videos.